first medication that we're going to review for your fertility cycle is Ovidrel. Ovidrel is a medication that is used for ovulation. It either prepares you for possibly an egg retrieval, or it prepares you for an intrauterine insemination. And it just depends on which center and clinic you're working with as to which medication they use to help with that ovulation. But Ovidrel, just first off, just so you know what you're going to need, my biggest thing with Ovidrel or any of the medications in teaching is just to tell you what supplies you need before you get started. So just a little sheet here is letting you know that the supplies you need for Ovidrel is one pre-filled syringe of Ovidrel. It's nice and simple. That's only one item that you need. So to start out with this medication for ovulation is really easy for patients typically to use, and hopefully it'll be easy for you too. The nurse and me, the other part of this is very important that you know that doing a medication is not a sterile technique, but it is a clean technique. So once you get your box of Ovidrel and you're preparing yourself to prepare for the injection, what I want you to know is just go and wash your hands first, or if you have a little bit of bacteriostatic hand sanitizer, what I want you to know is just either way, it's just good to start off with clean hands, okay? This medication, like I said, is for ovulation, but the other thing that I want you to know about it is that it is a subcutaneous injection, which means it just goes into the fatty tissue, which is good because that's a small needle, and usually those are easier to sometimes tolerate for patients because they're a little bit easier to administer, and literally the pinch you feel is like a mosquito bite. So to give you something that you've already done, possibly to make this seem not so daunting, is if you've had blood drawn, you have done something more evasive than this injection. Little injections are a little pinch. That's literally all they are in the skin. So first off, when you open up your box of Ovidrel, what you're going to find in there is your syringe is going to be pre-filled, pre-dosed, ready to go. So as far as for patients go, this is one of the easier type of medications we could have you take for your fertility cycle because all you're doing is injecting. And we would always guide you at the center, your center, wherever you may be, with when you need to take it and what time, if there's any sort of time requirement for you with your center. So let me just open that. There we go. In the box is a syringe. You'll see it's pre-filled with liquid. That liquid is ready to inject. That's the medication. So simply, sometimes what you might see that people hear about is bubbles, and if you're worrying about any bubbles, you just give a little snap to the syringe and the air bubble rises to the top. I kind of I sometimes discourage short of shooting liquid out because that is precious medicine to your cycle, so I don't want you to lose anything. So it's okay if you do a little bit of push with the syringe, but just be very, very careful if you do that. So I'm not going to uncap it yet because I want to show you where this injection goes. And with the help of my injection mannequin, what I want to show you is for this injection, typically you're going to use the lower abdomen, lower belly below the belly button. And when you take this, this is a one-time shot, so it can go anywhere in this belly. The other area to use are your upper thighs or outer thighs, because again, this is a fatty shot, so it just needs to get into that subcutaneous tissue. This injection can either be self-injected or you could have somebody give it to you. So what I'm going to do here is actually, if I were self-injecting and I was standing, and this is my body as the mannequin would be here, I just want you to see that the needle would go in at a 90-degree angle. The other part of this type of shot is that you pinch the skin just a little bit when you administer it because you want to make sure that you're getting into the fatty tissue. So first thing we do to that area is we clean it with alcohol. Just get a good little clean there. Next step we do is we can uncap the needle. Just be careful. Put that cap down. And here's where I said that if you did a gentle little push-up with the liquid, if it comes out, you can do that, but you want to gently push that up and create a little bubble, and that bubble or a little release of liquid, and that's fine. And then what we're going to do is we would pinch the skin in this belly, and we don't have to jab. Place the needle gently to the skin, insert the needle all the way, let go of the fatty pinch, push the medicine all the way in, count to 1, 2, 3, and then release and take out that syringe. And you can put a little cotton ball there. You might get a little bit of the fluid from the medication, or possibly a little bit of bleeding that you could have as well, but that's fine. That's what you should notice. The bleeding would go away pretty quickly. So with this medication, what you want to know about the injection is it's very quick. It goes in quickly. It's a little pinch when it goes in, and Ovidrel doesn't typically sting. Some medications can, and we'll talk about that if we have any. But just for this medication particularly, it's not usual that you'll find that it stings. Hopefully this has helped you to see how to work with your Ovidrel medication, and I wish you the best of luck with your cycle.